For anyone living with bipolar disorder, it's a tough road. It's a lifelong challenge filled with really intense mood episodes. And while medication is, of course, the main treatment, it often just isn't enough to stop those episodes from coming back. So the big question is, what else is there? Well, researchers are now looking at a really powerful therapy called dialectical behavior therapy. But can a treatment that was made for a totally different condition actually be a new piece of the puzzle for bipolar disorder? Let's find out. All right, so here's our game plan for this explainer. We're going to start by really understanding this treatment gap that exists. Then we'll introduce this new therapeutic tool, DBT. We'll dig into how researchers sifted through literally hundreds of studies, what promising signs they uncovered, and, just as important, what the fine print says. And finally, we'll look at what has to happen next. Let's dive in. So why is this research so important? Well, it all comes down to something that experts call the treatment gap. See, bipolar disorder is a chronic illness, which means it's long-term, and it's defined by these relapsing episodes. And while medication is absolutely crucial, it's often not a silver bullet that stops those relapses completely. And this right here, this is the heart of the problem. This stat comes from a major study, and it's pretty staggering. Even when someone is on the best possible medication plan, nearly half of them will still experience a relapse. I mean, think about that for a second. It's basically a coin flip. This is that treatment gap that has researchers urgently searching for psychotherapies that can step in and help.
So, what could that psychotherapy be? Well, this is where a potential new tool comes into the picture, dialectical behavior therapy, or what everyone calls DBT. This therapy has been a total game changer for other conditions, and that got researchers asking a really interesting question: could we adapt it to help people with bipolar disorder too?
So what is DBT exactly? It's a very structured kind of therapy that was first created to treat borderline personality disorder. And the core idea is kind of revolutionary. It's less about just talking through your problems and way more about actively teaching you a set of concrete, real-world skills to manage intense emotions and get through really tough situations. And these are the skills we're talking about. DBT is built on 4 key pillars. First, there's mindfulness, which helps people stay grounded in the present moment. Then you have interpersonal effectiveness, which is all about communicating your needs and building stronger relationships. Third is emotion regulation, which teaches you actual strategies to manage overwhelming feelings. And finally, distress tolerance gives you tools to survive a crisis without making things worse. Okay, so this slide right here, this gets to the why. Why even think about adapting a therapy for borderline personality disorder? Well, it's because of this huge overlap in some of the toughest symptoms: mood instability, impulsive behaviors, and suicidality. The thinking was pretty straightforward. If the skills in DBT can help manage these issues in one condition, hey, maybe they can help in another. Okay, the theory makes a lot of sense. But what does the actual evidence say? To figure that out, researchers didn't just run one new study. They did something way more powerful: a systematic review. You can think of it as a study of all the other studies. It's a super rigorous process where they find, evaluate, and combine every piece of research ever published on the topic to get the big picture. And their search started incredibly wide. I mean, they cast this huge net and pulled in 848 different studies that seemed like they might be relevant. From there, they had to go through and screen the title and the summary of every single one. After that first big cut, the number dropped way down. Only 28 studies looked promising enough to move on to the next stage, which meant reading the entire paper to see if it met their super strict criteria. And after all that meticulous work, only 11 studies made the final cut. This whole funneling process just shows you how careful they were, making sure that only the most direct and relevant research was used in their final analysis. So after all that filtering, what did those final 11 studies actually tell us? Well, the researchers basically broke their findings down into 2 main buckets. How did patients feel about the therapy, and did it actually work? And here they are, the 2 big takeaways. First, the good news was really clear and consistent. DBT is both feasible and acceptable. In plain English, that means patients were able to stick with the therapy and they felt it was a worthwhile thing to do. The second finding, about effectiveness, well, that's where we have to be a little more careful. The studies gave only preliminary evidence that DBT might improve symptoms. And that one word, preliminary, is absolutely everything here.
And that word, preliminary, brings us straight to the fine print. Because in science, understanding the limitations of the research is just as critical as knowing the results. It's the reality check that stops us from jumping to conclusions too fast.
So, the review pointed out 4 big issues. First, all the studies had really small sample sizes, which makes it hard to know if their results would apply to a bigger group of people. Second, they had a high risk of bias, meaning the way the study was designed might have skewed the results. Third, there was high heterogeneity, which is just a fancy science way of saying all the studies were a bit different, kind of like comparing apples and oranges. And finally, participants weren't blinded. They knew they were getting the special therapy, which can create a powerful placebo effect.
And hey, don't just take my word for it. This quote from the researchers themselves says it all. They're being totally upfront, saying that while the results look promising, their confidence is limited because of all those issues we just talked about. This is what great science looks like, being honest about what you don't know yet.
So, when you weigh all the promise against all those limitations, what's the bottom line? And where does the research go from here? If there is one thing you take away from all this, let it be this. DBT is a promising therapy for bipolar disorder. We know patients are on board with it and can stick to it, but we can't say with any real confidence yet that it's truly effective. The takeaway is simple. Promise, yes. Proof, not yet. So the path forward is crystal clear. The next step has to be large, well-designed, randomized control trials, or RCTs. These are the absolute gold standard in medical research because they randomly put people into either a treatment group or a control group. It's the best way we have to remove bias and get the clearest possible answer. This is the only way we're going to know for sure how effective DBT really is for this group. And that leaves us with a pretty fascinating final thought, doesn't it? This whole story of DBT and bipolar disorder is a perfect example of scientific creativity. Taking a tool that works for one problem and seeing if it can be tweaked to solve another. It really makes you wonder, what other amazing therapies are out there right now, just waiting for a researcher to ask a new question and unlock their potential for a whole new group of people?